The country woke up to a shocking news on the weekend that a 42-year-old actress, Shefali Jariwala, best known to our generation as the Kanta Laga actress, was found dead, and that it was possibly because of the cardiac arrest. Now, as the police are trying to assist in the investigation, they found 2 boxes containing anti-aging skin glow medications as well and vials at her residence. This may seem common, especially when you're from the entertainment business. But while the post-mortem results are still awaited, we are not making any conjecture, but the officials have said that they are examining all angles, possibly the effects of medication, on the day that she was fasting. Jariwala had basically been fasting for a puja ceremony at her house on the day, and then while the medications were consumed. Could that have triggered the cardiac arrest? This is one of the angles being investigated. No foul play as of now, but it has led to a lot of questions and concerns. Too many cardiac arrests, heart attacks are happening, even to the, so to say, a younger population of this country. Do we have to look at different angles, and especially this time as well? All right, so as we look at the details that are coming in, we want to understand this, remember, especially at a time when this is not about conclusions and conjectures, but it's important to examine with our experts what may have happened in this case. Dr. Viral Desai, cosmetic and plastic surgeon, joining me on the panel. Dr. Sudhir Kumar, neurologist as well. In fact, if my colleague Sneha Murdani is also with us, I want to bring her also in this conversation from the newsroom because she's been closely tracking this case. I want to start with you, Dr. Viral Desai, because I understand it's a sensitive case. When you hear of the medications that are being used, why is the empty stomach fasting on the day while you're consuming medications is being seen as an angle here? What can go wrong in these cases that can lead to a cardiac arrest? Go ahead, sir.
Okay, so let me first start by saying that a lot of people are on anti-aging, so-called anti-aging medication and treatments. Okay, we have been hearing, as you rightly said right at the beginning, that we've been hearing about a lot of young people dying in the gym while cardiac arrest. Unfortunately, certain colleagues of mine also, I have known this. There could be so many factors like stress. At one point, even vaccination was blamed or post-COVID was blamed. But generally, people tend to be very, fast in judging anti-aging treatments and saying that was the cause. In my opinion, and not because I'm in this field, but for any kind of anti-aging treatment to actually cause this, and I'm only talking science here, evidence-based medicine, nothing which is out of the box, okay? To cause a death or anything like this is practically unheard of or impossible. It is so rare that we should not look at that angle. There could be many other reasons, right from a stressful life to so many other things which have there. As you rightly said, the post-mortem is not conclusive. So we need to see what it actually comes to. But anti-aging medicine per se causing any kind of cardiac issues is, according to science and evidence, very, very extremely rare or unheard of. Okay. So I don't think we should prematurely blame these kind of medications.
But the important points also you're making, and sometimes while we are focusing on the outer body, we also do not realize what may be happening inside, and that needs constant checks and examinations too. I request you gentlemen to please stay on with me. Sneha Murdani closely tracks the health fraternity. I bring her in here. Sneha, why don't you take the questions? Over to you.
That's right, Pooja. Thank you so much for that. Dr. Viral Desai, before, I just want to, in fact, go across to Dr. Sudhir also for the epileptic link that he has also spoken about that could have led to this sudden cardiac event, which again, like Dr. Sudhir, you said is very rare. But to you, Dr. Viral Desai, first, you did mention that it is extremely rare, but it is not completely ruled out. And that's the reason why the Mumbai police are also looking at it. The toxicology reports are awaited as of now. It's glutathione, it's medication, it's injectables that have been taken, reportedly, as the reporters have been telling us, on an empty stomach. What does it do to your stomach lining when there is no food inside your system when you're taking these medications? There are established side effects, Dr. Viral Desai, of these medications even when taken when your stomach is full. For example, nausea. So are you saying that this has to be completely ruled out? And if yes, why so?
If I may, so if we are talking
Yes.
about anti-aging medications, we still don't know what she was taking. If it is something as easy as minerals and vitamins, okay, why would they cause this kind of a problem? And why would they
Okay.
cause any issue? Okay,
Okay.
first. So we don't know what is there in the content.
What
So
about
that's very
glutathione?
important.
Okay, reports do indicate, because we're waiting officially to hear from the police. What about glutathione and collagen supplements? I mean, I
You
understand
know,
these are wellness products at the end of the day, but they're not without side effects, isn't it, Dr. Desai?
even a small tablet of crocin has got side effects.
Of
Every
course.
single medicine,
Yes.
antibiotic that you take, if you read about it, you read the disclaimer behind it, you will be scared to take any medication. You'll probably not go to a doctor ever in your life. Okay. Do we conclude that these can cause such problems? Glutathione is basically something like an antioxidant. It's also like a liver tonic. I mean, I'm putting in very simple words. Okay. It has some kind of aesthetic indications, but mostly all our qualified doctors like us, we don't use it for aesthetic, but it's
Okay.
more for the antioxidant and the anti-inflammatory effect.
Okay. Okay.
That the doses we prescribe are very, very low, and for them to cause such a problem is practically unheard of.
Okay. Dr. Desai, I want to ask you, what is the impact of these medications if taken on an empty stomach? Because, like reports have been indicating, that she was, fasting on the day of her death.
So empty stomach, these, like again, you if you're mentioning vitamins, minerals, empty stomach at the most they may cause some little bit of irritation or gastritis, but not cardiac death. They don't have cardiac relations to it.
Okay.
Okay, you may have some regurgitation, you may get some irritation, gastritis because your empty stomach, and they may irritate your mucosa. Okay, I'm just putting in
Okay.
simpler words. But death, why? I mean, just we just cannot start blaming anti-aging
No,
and
no,
all
don't
because
get me wrong. Don't get me wrong. I'm just trying to understand the possible link here. We are also
yeah,
doing this
yeah,
very responsibly. You have to understand. The
yes,
postmortem
yes,
report is
yes,
awaited. We are just asking you questions around what is being said right now and what are the
absolutely.
authorities saying. It is not to say that glutathione caused a cardiac arrest. It is to say what could have, led to this death. And similarly, Dr. Sudhir Kumar is a neurologist from Apollo Hospital in Hyderabad is also now joining us. Dr. Sudhir, you spoke about the fact that she was a patient of epilepsy for half her life, 15 years, actually more than half her life. She died at 42. The fact is that it causes sudden but rare deaths as well. Talk to us about that possible link here, Dr. Sudhir.
Yeah, definitely. If we just
Yes.
look at generally about epilepsy, so epilepsy can rarely cause SUDEP, which is sudden, unexpected death in epilepsy patients. And
Yes.
incidence is rare. It is like 1 out of 1,000 people with epilepsy. But people who have uncontrolled epilepsy, like more frequent seizures, it can even affect 1 out of 150 people.
Right.
No, why it happens is if you look at epilepsy patients, they can have a seizure during sleep, and when there is seizure, just after seizure there can be depression of the respiratory functions that can lead to cardiac arrest. Second is the seizure itself can cause cardiac arrhythmias like ventricular fibrillation. Again, that's a cause of cardiac arrest. And thirdly, seizures can sometimes cause autonomic nervous system involvement, and that can cause drop in the heart rate, blood pressure, and respiration, again resulting in cardiac arrest. And
Right.
finally, if the person is lying prone, face down, then the respiratory, the secretions in the mouth like saliva and other secretions can cause choking, and that also can lead to cardiac arrest. So these are some of the mechanisms proposed for SUDEP. So here we don't know whether she had a seizure or not. So definitely we need to rule out other causes of cardiac arrest, which will happen after post-mortem. And then if all other causes have been ruled out, then SUDEP is one of the possibilities which can be considered in a person who's already known to have epilepsy. And she's on record to say that she's had frequent seizures at various places. But we don't know the current medications and current seizure frequency in her case. So difficult to pinpoint that, but that is one of the possibilities to keep in mind in a person with epilepsy.
Okay, Dr. Sudhir, I want to ask you, we are, and I want to reiterate that this is not to blame glutathione or any other collagen supplements or any other vitamin mineral supplements that she's taken. It's not to, brand an entire industry of wellness products with the same brush and say that this is what is causing heart attacks in young people like Shefali. But I want to ask you, the impact of taking medications, including these kind, even though under supervision on an empty stomach, what role it could play in dropping your blood pressure levels and blood sugar levels as well in diabetic patients. What's your assessment, Dr. Sudhir?
Here I would agree with Dr. Viral Desai. He's already clearly mentioned that there are a lot of evidence-based medications and vitamins. So for them, there are no issues. But here we do not have the entire list what medications she was on, so we need to wait for that. Other is the therapeutic dose versus overdoses. We don't have data on that, so we need to look at that. But regarding fasting for a day, it is quite safe. Many people do fasting. In fact, fasting is good for our health also. So that should not cause any problem. Just 1 day of fasting, and so here basically it is difficult at this point without knowing her entire list of medications or what anti-aging treatment actually she was taking and the dose of that and whether any overdoses were involved or not, because we know that certain vitamins in overdoses can cause problems, but that's not very common. These things are quite rare.
Okay, not very common, quite rare. Like both these things are very rare. Sudden deaths due to epilepsy and also a death because of medication overuse, especially medication and products like these are wellness products that you mentioned. Talk to us about what would your word of caution would be for those patients who are taking these medications regularly. What would be your word of advice, and what are the possible risk factors that you would like to use our platform to flag off today?
Absolutely. So actually, a lot of unqualified people are practicing so-called aesthetic medicine. Okay, you see a lot of aesthetic procedures being done in parlors by unqualified people. If you want to go, you always find a board certified doctor, either a dermatologist or a plastic surgeon. Okay, for that matter, in most cases, you have to go to somebody who's qualified, who's registered, and then you have to be careful. You cannot go to anybody, and definitely do not self medicate. Do not follow trends which are online or on social media and start medications yourself. That can be dangerous. Everything has to be monitored. It has to be in the right dosages. So it's important. That's one word of caution that I would like to give.
Right.
Apart from this, it's very, very safe. If you follow these basic principles, it's a very safe.
These are very safe. And what about nausea, dizziness? These are also some common side effects that are being seen with the use of anti-aging medications.
Some of them, some weight loss medicines nowadays popular may have some amount of nausea. Some of them do it, but those are easily treatable. You can easily manage them even without medication in most cases, or you need some additional medication, like maybe for a short time, an anti-acidity pill or an anti-vomiting or anti-emetic pill. But this very rare. Even these kind of side effects are very, very rare with this medication. Okay, they're generally
Yes, sir.
safe.
Dr. Sudhir, at the very outset when this case was reported, I remember having a conversation with you about this as well on younger people succumbing to cardiac ailments. Talk to us about whether it is just a perception that it's becoming common, or are we just, predisposed to it, and it's just that so many cases are surfacing nowadays. If you look at the numbers, it's not like something that's extremely uncommon. What do you think about these recent cases, many of them in fact captured on camera, of younger people, just dropping dead? It's just become frequent, isn't it?
This is a very important point actually. So I would like to say basically 3 points here. Number one is that definitely the incidence and prevalence of heart attacks, strokes, and cardiac arrest have increased over the last say 5 to 10 years. Especially after COVID, we have seen an increase. And the second part is that we are also seeing a shift in the age group. So earlier these were happening in people above 50 or above 60. So now we definitely see that younger people in their 30s and 40s also are getting affected with this. And thirdly, of course, the publicity or the media, everyone has a mobile camera, mobile phone. So the publicity also is more. So even though number of cases may be less, they get wider publicity. Now, if you look at the main root causes for that, so one is sedentary lifestyle. So with the lockdown, many people became sedentary and they have
Yes.
not been able to increase their physical activity. Second is we all know the stress levels are definitely going up. I hardly see anyone who says that they are stress free. Then sleep deprivation, another factor, because 7 to 9 hours of night sleep is required for optimum health. That is missing, and junk food, unhealthy food. Many people are now ordering online and having those food which are not healthy. So these are some of the things, and it has been shown in the other risk factors like overweight, obesity, diabetes, hypertension. All those risk factors have gone up in younger people as well as older people, even children now.
You know, Dr. Sudhir, one important point that I would really want you to emphasize on is the fact that the people who are going to the gym are not necessarily the healthiest people, really. You know, it's actually just so holistic in more ways than one, isn't it? It's not just about hitting the gym every day. So, you know, a lot of people say, oh, that person was, in the gym, has been working out regularly, but he dropped dead. So if you could just speak to us a little about the significance of holistic health, including mental health, and that is just so important because in my opinion, I would say that, anxiety and depression are silent killers. They may not be screaming from the rooftop for attention like other physical ailments, but they require just more attention than anything else, isn't it, in this day and age?
Yeah, definitely. See, there are
Yes.
two or 3 points here. One is that going to the gym is a good habit, is a healthy habit. So let us not demonize it. So that's a good thing.
Yes, yes.
Second thing is just going to the gym alone is not enough. As you already pointed out, there are other aspects to healthy living, which includes good sleep, having a stress-free life, having healthy food, healthy relationships. So all these things, combined together make for a good, healthy life. And along with the gym, where it's mostly strength training, aerobic exercise also are required, which could be cycling, walking, running, or swimming. So we need a combination. And lastly, I would like to point out is that over gymming also is not good because most studies have shown that if there is excess of strength training or excess of gym workouts, then the benefits initially will start plateau and then there will be decline. So
Okay.
over exercising also is not good. And then
Right.
many people they miss out on their sleep and then go to the gym. They overwork. So they hardly sleep. So one should have the adequate amount of sleep and then spend 30 to 40 minutes in the gym, and that should
Okay.
be ideal.
All right, Dr. Sudhir, just be with us. 30 seconds, Dr. Viral Desai, on the significance of, regular preventive health checkups. Dr. Desai.
Yes, absolutely. So actually nowadays everybody is quite aware. Most of the people who come to me, even my relatives and friends, are getting themselves regularly checked up at least annually, if not more frequent. But generally an annual checkup is enough. Do not need
Okay.
to overdo it. There are people who check up their blood tests every 3 months and 2 months. No, annual checkup is good enough. Like Dr. Sudhir mentioned, the state of mind, your stress levels, your generalized lifestyle, these factors play a very important role. And yes, moderate amount of gymming, healthy, good diet, all these combined actually make a good lifestyle. Sleep on time, get up on time. All these things, everything matters.
Okay, all right, absolutely. Dr. Sudhir, 30 seconds to you. You had put out a list of kind of, checkups that everybody hitting the gym should be doing since there's a bit of a scare around working out and, cardiac arrest. Quickly, if you could just tell our viewers what these, these basic tests should be. Dr.
Yeah,
Sudhir,
basically we
yes.
can look at mostly the risk factors which can increase the risk of heart attack and strokes. So in that we have the glycemic parameters, mainly the fasting blood glucose, HbA1c, insulin levels, and then we have the lipid parameters. In that we have the LDL cholesterol, triglycerides, and also our apolipoprotein A1 and B. So this will give the idea about the lipid levels and then homocysteine levels. So these are some of the blood tests that needs to be done, and then in addition to that, we should look for vitamin B12, vitamin D, and also hemoglobin and
Okay.
iron and ferritin levels. And finally,
Basically, yes,
yes,
basically take these precautions and do these checkups if you're hitting the gym is what Dr. Sudhir is emphasizing on. Speaking on the possible epileptic link, Dr. Viral Desai, we spoke to you because there are reports of glutathione, anti-aging medications, and also collagen supplements, other supplements that the victim here had been taken. Of course, that's a link that only the authorities in this case, the Mumbai police and also, of course, the doctors looking at the toxicology report would eventually talk about. And the post-mortem report will obviously throw light on what could have happened to Shefali. I'm going to thank both of you for joining in, for sharing your views with us on that big story.